Hello everyone, and welcome to our 87th AeHIN Hour. This webinar runs on GoToWebinar. If you need assistance, please feel free to send us a message through the chat window. If you are having difficulties in configuring your connection, please log out from the session and rejoin again. You may also use your smartphones or tablets to join by using the webinar ID 456-128-627. Please be reminded that all microphones are muted throughout the meeting. For comments, please use the chat box, and for questions, please use the questions panel. We would like to introduce tonight's speaker, Dr. Yong-Moon Che. He was president of the Korean Society of Medical Informatics and dean of Yonsei University School of Public Health, Korea. At present, he is an honorary professor of Mongolian National University of Medical Sciences. He is also COFI advisor to the Center for Health Development, Ministry of Health, Mongolia. We will now call on our speaker, Professor Che.
Thank you very much, Cha. May I start my presentation?
Yes. Please click Show My Screen.
I'd like to present my work on mHealth for visiting home services in Mongolia. This is a 2-year project that started January last year, and this is funded by WHO and COFI, that's the Korea Foundation for International Health. In this presentation, I'm going to first talk about some, as a background, health status and health systems in Mongolia, and briefly talk about why do we need an mHealth system in Mongolia. And then briefly talk about mHealth goals, and then concept as well as some framework for mHealth system. And I'll be talk about mHealth application system for VHS. We also have developed web version of a visiting home services for laptop and desktop for at the family health centers. And then this project, we have developed the first version of system last year, and then pilot tested for 4 months last year, and then I'll be briefly explains the results of pilot testing. And then we are developing several systems, so I'll be briefly explain what we are developing now. I'm showing the health status of Mongolia as well as Korea in order to give you a better picture of health status of Mongolia. The population of Mongolia is 2.9 million, close to 3 million, and life expectancy is quite low, 68.9 compared to 82.8. So you can see that they have very short life expectancy. And medical expenditures only 5.3% of GDP, and they have a very high infant mortality rate with a 22.4 per 1,000, and very high maternal mortality rate, and also the inadequate number of beds per 1,000 persons. And some specific disease characteristics are the cause of death. The cardiovascular disease is 35.1%, followed by cancer. So you can see that they have some problem of managing non-communicable disease, chronic disease. And cancer type, the liver is a #1 cancer because of high prevalence of hepatitis and also alcohol drinking. And morbidity is also respiratory disease because of the air pollution. According to a UN survey, Ulaanbaatar has the worst the air pollution, especially during the winter. And risk factors for most of the disease is a lifestyle. These Mongolian people, is their main meal is meat. They don't use much vegetables, so the eating habit is a very serious risk factor. And also many men drink heavily, and also smoking, air pollution. Those are risk factors. And health systems, they have a good national health insurance. So most of people are covered by the national health insurance. And they have a 3-tier health systems: primary, secondary, and tertiary. In order to be treated at a secondary or tertiary hospital, you have to first go to district or zone family health center first. And then when a general practitioner refer the patient to secondary hospital, then you can get a medical treatment at district hospitals and tertiary hospital. There are only 14 tertiary hospitals, and all of them are located in Ulaanbaatar, capital city. So their problem with health systems are lack of quality doctors, and also poor medical facilities. So many severe patient, cancer or cardiac patients go to foreign countries such as Korea or China and Singapore for the treatment. And also another problem is a lack of health IT infrastructure. And so far, no public hospital has electronic medical record. And many of public hospitals don't even have paper-based medical record. So that many Mongolian people carry their own medical record notebook. But if you lose that medical record notebook, then really there's no information about past medical history. So there's a great need for information system to have a continuity of care. So now let's talk about why do we need mHealth system in Mongolia? And because Mongolia is a big country, and more than 1/3 of population people live in Ulaanbaatar, and many people live in a remote area, and they have a very great difficulty of accessing healthcare services. And they have a very, as you can see, a poor health status and inadequate health facilities and inadequate health information system, such as electronic medical record, so that they don't have any information and it's difficult to access health facilities. So really, but we are seeing a rapid rise of mobile phones and smartphones in Mongolia. especially among young people. So, and also we believe that mHealth, using this kind of mobile phones and equipments, can really increase the access to healthcare and health access to health information. And the mHealth project goals, and therefore, are to develop a mobile app program for visiting home services. First, we are focusing on visiting home services. And secondly, to develop the web version of visiting home services for information exchange and data entry to be used at a family health center. Mobile application system alone is not enough to provide adequate visiting home services. Because, as you can see, we are also using mobile devices such as the ultrasound, mobile ultrasound, and mobile ECG, and their data has a really rather big, the images have a rather big capacity, volume, so that we have to upload that information for storing, and also to be sent to district hospital for referral. And we believe that mobile system and the web version system, they really complement each other very well. And the mobile system alone may not be enough to provide adequate services. And also, we are developing the personal health record using a smartphone and tablet PC. So those are important mHealth goal. This mHealth system is a part of our National Health Information System Development Project. This National Health Information System is called AeHIN. Right now, we is a version 3, and current version 3, AeHIN 3, has several limitations, and so that we are developing some more. This is an overview of a National Health Information System called AeHIN 4, and currently more than 3,000 private as well as public hospitals are using this AeHIN 3, and it is required by law for the statistical data reporting purposes. Existing AeHIN 3 has mainly these two functions: statistics reporting and insurance. And so in this new version, AeHIN 4, we've been developing this version 4 since last year, and by the end of this year, we're going to add 3 more modules. Mainly, we are developing electronic health record and disease management for non-communicable disease as well as communicable disease. Especially for communicable disease, we are developing EBS, that's event-based surveillance system, for the first time in Mongolia. And for so that mHealth is a part of our national health information system. And in this mHealth project, we are developing visiting home services, which is main topic of today's presentation. The reason why we say VHS Plus is that we added this module called Heart Score, and which will be discussed later. So we are developing a VHS Plus system, which includes Heart Score in addition to visiting home services. And also we are developing personal health record, which is a mobile version of EHR. And then we are also developing interface module with mobile devices such as mobile ultrasound and mobile ECG and mobile blood pressure. And in this statistics and planning module, the current version, H143, only has statistical reporting system, and this model collect all the statistical data and publish the quarterly and yearly data. But we are developing a planning module, a web-based planning module, so that the planners at the national level and Ulaanbaatar and 21 IMAC health department can use this information for planning their health services. And also, the current system is not web-based, but this new version 4, it is web-based, so that it could really improve the information flow. Now let's briefly talk about the conceptual framework for mHealth and visiting home services. mHealth can be defined as a diverse application of wireless and mobile technologies designed to improve health services and health outcomes. And it also includes any wireless devices. In this case, we are using mobile ultrasound and ECG. And also, this mobile health system is really applications are very rapidly increasing, and also the smartphone technology improves. This is a continuum of mHealth. In the beginning, mHealth has been mainly used as a measurement tool, but we are seeing more and more mHealth as a diagnostic tool at the point of care. And then this mHealth system has been also widely used for treatment of a chronic disease. And then also we are seeing mHealth as a more nationwide basis. For instance, we are using mHealth in our event-based surveillance system for detecting and reporting infectious disease. So we are seeing the scope of mHealth is greatly expanding. This is a conceptual framework for our mHealth system. It has several functions: visiting home services and Heart Score, which will be discussed later, and family health services and interfacing with mobile devices, personal health record, and is used. We have a module for patient referral, and this all functions will be used and linked with the national system using health information exchange module. The national systems are national non-communicable disease system and some disease screening system, and also this mobile system is linked with a hospital electronic medical record and the EHR, and also will be linked with telemedicine, and we'll talk about special type of telemedicine which will be linked with our mobile system. And we are working on linking our mobile system with the Teledermatology system. Of course, this mHealth system was closely linked with other functions of AeHIN. And also, this aggregate data from this mobile health system will be drilled down for the analysis of some disease patterns and utilization pattern and so on. Now let's talk about the concept of visiting home services. Visiting home services is a component of a continuum of comprehensive healthcare in which health services are provided to families at home for the purpose of health promotion and screening. And the primary goal for VHS is to screen for early detection so that you can prevent hospitalization. Advantage of VHS includes the high-risk patient can be easily detected, and also it can provide healthcare services for those who have difficulty with moving, especially for the elderly patient. And we are seeing a great increase of VHS because of this several factors. The main factor is the increasing elderly population, especially for those who have difficulty of moving. And also rapid advancement of mobile technology is another important factor for the growth of VHS. And also rising cost of hospital care is also another factor. So there are many studies on cost effectiveness of a mobile mHealth system and mobile visiting home services. So that expected benefits of a mobile visiting home services are they can improve the quality of the visiting home services by capturing system and screening information from patient home, and it can improve the patient referral to secondary hospital by capturing and sending a diagnostic image directly from patient home using portable devices. So in our mobile health project, we are sending the images from mobile ultrasound and ECG directly to secondary and even tertiary hospitals. Also, it improves the quality of communicable disease as well as non-communicable disease management by monitoring of patients. And also it helps improve the quality of health statistics, because we can collect raw data from grassroots level. We have this is a screenshot of a Mongolian version of mHealth system. We have developed this mHealth system using Samsung Galaxy Tab, and we are currently developing Apple version, iOS version, so that in a few months we'll have both Android version as well as iOS version. We have also developed this system in 2 languages, Mongolian language as well as English. And English version, these 2 versions can be downloaded from Google Play Store. There are several functions of this mobile VHS. First of all, registration for patient and doctor, and also this health screening data as well as image data from ultrasound and ECG can be uploaded and downloaded to a web version. It also has a physical exam, heart score, and then we have a screen for doctor's overall assessment, so that whether doctor can refer the patient to a secondary or tertiary hospital. It has it has a screening for communicable disease as well as a non-communicable disease. We'll add some more non-communicable disease later on. So actually 3 more screening system. And currently we are using 3 mobile devices, and we are doing a screening for 2 cancers, cervical cancer and breast cancer. Now let's talk about heart score. Heart score algorithm was initially developed by WHO, Western Pacific region, and they developed the standalone mobile version of heart score. But in our project, we just, with the permission of WebPro, we are using their heart score algorithm in our system in order to screen for heart patient. This heart score can be used to estimate heart risk score by using several data such as physical exam, smoking, blood pressure, and blood cholesterol level. And so if you enter these information, you can estimate the system gives you a heart risk score. So this is a screen for heart score. If you enter all this information, blood pressure, smoking, that status, then it gives you a risk heart score level. In this patient has a less than 10%, very low risk of heart disease. So this information can be used to screen and monitoring the heart condition of the patient. This is a screen for hypertension management. As we mentioned, we also developed a web version of VHS. This web version was developed for several reasons. To be used for laptop and desktop for family health center. And because of capacity limitation of mobile phone and Galaxy Tab, there's a need for uploading and storing image data from mobile devices. And also, we need to send this screening data to electronic health record for patient referral. And also, in order to download this aggregate data for further analysis, there's a need for developing web versions. So that, as you can see, the mobile, some people believe that the mobile mHealth system alone can do everything, but we believe that there's a great need for web version of the mHealth system as well. This picture shows how web version and mobile version can exchange data. First, mobile version, mobile VHS screen, collect the screening data and send to the server, and that that information can be used in a web version system. And so that this web version, using web version of VHS, the patient referral information can be sent to EHR or to secondary and tertiary hospitals. This is a screen for the VHS. And this is a screen for mobile devices for VHS. And this is a mobile ultrasound. And this device is a mobile ECG. And this device is a mobile blood pressure measurement. And this one is a Samsung Galaxy Tab. And also we provide the SUV vehicle for visiting home service team. So we provide one vehicle car to each of 6 pilot sites. So we've been testing this system at 6 sites in 2016, such as 3 sites in Ulaanbaatar. This is a low-income district, but is underserved area. And then we selected 3 sites in Gobi Desert area. It's a very remote area. And we conducted this pilot testing for 4 months in 2016, and currently it's being implemented now. And this year we added 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 10 more pilot sites. So that right now, currently, this mobile health system is being implemented at 16 pilot sites. And Mongolian Ministry of Health is very encouraged by the positive outcome of this implementation, so that they have a plan to disseminate this mobile health system throughout the country by the end of next year. So we have a very positive result and strong support from the Ministry of Health. We have some, I'd like to show some the outcome or results of pilot testing from last year. Total of 14,242 people were screened, and about 61% of them were over 18, and then we have some children. From the screening of hypertension, we have detected 442, 13% of the screened people have confirmed hypertension. So we also found some suspected high blood patients from blood pressure by using a blood pressure measurement system. And then from these are the result of mobile ECG, and we were able to detect 7.6% of confirmed the heart patient, and 22.4% of patient had positive cases. And from ultrasound test, we found 35.3% of confirmed some cases with problem of mainly liver cases. Now let's briefly, I'll conclude my talk with the future plan for mHealth. We are developing electronic health record. We hope that we can complete it, development EHR by the end of October, and then we'll we also develop interface module with the hospital electronic medical record. And also we are going to develop a personal health record. And then we are developing 3 additional screening modules. First, for antenatal screening module. As we discussed, the Mongolia has a very high rate of infant mortality rate, and so that and also we have a very high rate of maternal mortality rate. So we are developing 2 screening modules: antenatal screening and newborn screening. And also because of eating habit, many Mongolian people like to eat sweets and some candies, so that they have a lot of dental problems, cavities, so that we are developing oral health screening module. And also we are trying to interface with the Teledermatology. This picture shows how the information will be exchanged between EHR and EMR and personal health record and VHS for referral and follow-up care. Mongolian Minister of Health has a plan to implement and install electronic health medical record for each hospitals, so that probably in 2 years, most of public hospitals will have electronic medical record. Once they have an electronic medical record, then patient information can be exchanged with the EHR, and then the screening information from a patient home will be collected through visiting home services and PHR, and it will be entered to a hospital-based EMR and EHR. And this is an overview of the electronic health record that we are developing. I will not go into detail about the electronic health record and electronic medical record, but these are the main difference. The EMR is specific to a hospital. Its main purpose is treatment. So it has very detailed information about medical care, whereas electronic health record is specific to individual health, and with main focus is health promotion, and it is a lifetime longitudinal record from birth to death, so that it includes some summary information, so that in our EHR has some immunization, vaccination, allergy information, as well as lifestyle information, and has a summary of a medical history and some summary of progress note. And we are developing CCD, that's a continuity of care document based on CDA, that's clinical documentation architecture from HL7. And this information will be used for referring patient to secondary and tertiary hospital. We try to use international standards such as LOINC and HL7 and SNOMED CT and ICD-10. We are developing 3 types of screening: antenatal care, born baby, in order to reduce infant mortality rate and maternal mortality rate. And also we are developing oral health screening module to collect, screening and collect the oral health assessment at the community, and collect, and we hope that this will help reduce some dental problems in the community. And then lastly, we are developing some interface module with teledermatology. You know, there are 2 types of teledermatology: live, interactive, and store and forward. And mainly we are using the store and forward method for receiving consultation from specialists at home. Why we chose teledermatology? Because especially in Gobi Desert area, there are many herders. They spend most of the time outdoor, and the Mongolia has very strong sunlight, so that they have many skin problems. And also, for teledermatology, you don't need much of a device, because Galaxy Tab already has a camera, a digital camera, so you don't need extra device. So that we believe that mobile health can play an important role in telehome care, and we chose teledermatology as some model, and we are using store and forward that approach. But there are some key issues in teledermatology: accuracy and concordance of teledermatology compared to usual care, and how do clinical outcome of teledermatology compared to usual care for skin condition, and the cost effectiveness and patient satisfaction. And we'll conduct some careful performance evaluation on these issues using some data from pilot testing, and then we'll try to analyze using randomized control design, some research design, to carefully assess the effectiveness of teledermatology using mobile health. And thank you very much for your attention.
Thank you for that presentation, Professor Chai. We are now open for questions. We'll be waiting for your questions in the questions box. Thank you. Professor Chai?
Yes?
We have a question from Dr. Alvin Marcelo. He's asking, can the app be in English?
Pardon?
Can the app be in English?
Yes, the English version of mHealth system is already available at a Google Store, Play Store. You can download it free of charge.
Yes, thank you, Professor Chai. I also have a question. Seeing that the application is available on Google Play, can it be used by anyone in Mongolia? I mean, if I'm not a health professional and I want to use the application so those health professionals can help me, how can I possibly enter data by myself?
Would you repeat your question again?
For example, I'm living in Mongolia and I'm not a health professional, but I want to try using the application. How can I use it if I don't know, like, my blood pressure, for example?
You can first get a user ID and password, and then you you register your name, and then I think you can use this as personal use, just like a personal health record. You don't have to be a doctor to use this system.
Oh, okay, thank you, Professor Che. I would also like to ask, is it being used in several health units? Because, for example, I cannot I cannot use the application by myself. Would there be
Mm.
someone who can help me?
Yeah, actually, our two programmers and the WHO officers are traveling several, as I mentioned, there are 6 pilot sites. They visit each pilot site to provide a training. Actually, I participate in several training myself, and we gave a demonstration, and we provide some hands-on experience, yeah, on an individual basis. So if you live in Mongolia, and then please let us know, and you can visit our office, then we can provide you training. My email address. Do you have my email address? Yeah, it's ymchae dot at gmail.com. So
Uh,
please let us know.
yes, thank you, Professor Che. We also have other questions here. This one is from Dr. Sanjay. He's asking, are the devices integrated or how is the data pushed to the application?
Would you say that again? Sorry.
All right, the question is, are the devices integrated or how is the data pushed to the application?
Hmm. Uh, Sorry again. Would you slow down your question and ask me slowly?
Okay, Professor Che. The question from Dr. Sanjay is, are the devices integrated?
Yes. Uh-huh.
Yes.
Yeah, yeah. 3 devices are integrated: the blood pressure management, measurement, and ultrasound, and ECG. So it's well integrated, and it's been used for more than a year now. And we'll add several more devices.
Okay, thank you. His other question is, how is the data from the devices forwarded to the application?
Uh, Sorry again, how the device?
Yes. How is the data from the device forwarded to the application?
Oh, yeah. First, for example, image from ultrasound can be seen at the Galaxy tab first. But if you have more than, let's say, 100 patient image from 100 patient, you have to upload to a web version. So that I think in our database for web system has the images from at least 1,000 patients, more than 1,000 patients. So all the images will be stored at the database, and can be but when a general practitioner want to refer the patient suspected case to a secondary or tertiary hospital, then that image will be forwarded to secondary or tertiary hospital, even to foreign countries. Yeah.
Yes, thank you, Professor Che.
Yeah.
The next question is from Dr. Alvin Marcelo. The devices are interesting. Are they already for sale outside Korea and Mongolia?
Sorry again. Would you say that again? That device?
The devices are interesting? Are
Mhm.
they already for sale outside Korea and Mongolia?
Yes. Yeah. Actually, those devices. Yeah. First, we wanted to use devices which are only certified from official organizations. So last year we used some cheap device, but this year we are using mobile devices certified from Korean FDA. So that device is very, very effective, and the cost has been decreasing.
Okay, thank you, Professor Che. Here's another question from Dr. Alvin Marcelo. Thank you for sharing, Professor Che. Is this project the only mHealth initiative in Mongolia?
Yes. Right now it's being used in Mongolia, but as I mentioned, this web application system has been already translated into English, and also web version system has been also translated into English. So, and then we like to we want our system to be an open source software. It can be used in anywhere in the world because it's in public domain, because this project has been supported by WHO and COFI, Korea Foundation for International Health. So it's open source.
Yes, but aside from VHS Plus, are there other mHealth initiatives in Mongolia?
Yes, as I mentioned, we are developing several systems, applications such as personal health record and 3 additional screening modules, and we hope to finish everything by the end of this year. So there will be a version 1, and we are talking with some funding agency for developing a version 2 next year. But we are planning to complete all this project, including AeHIN version 4 national system by the end of this year.
Yes, thank you. Seeing that there are other mHealth initiatives in Mongolia, how does the Ministry of Health coordinate these initiatives?
Oh, yeah, we report the progress of our report from time to time to Ministry of Health. So we closely work together because in order to disseminate the system throughout the country, we really need to work closely with the Ministry of Health. And so Ministry of Health has been very, very supportive to this project, especially Minister of Health is very, very supportive to this project. So hopefully this mHealth, especially mobile visiting health services, will be disseminated throughout the country by the end of next year.
Thank you, Professor Che. The next question is, does Mongolia assign a citizen ID, which can be used to merge data entered by different SOMs or regions?
Yes, they have a national registration ID number, which is very fortunate. So it can be used for exchanging information, health information.
Yes, thank you. The next question is, what is the profile of the users in the pilot sites? Are there elderly who are non-techie primary care providers? Were they able to adopt the system fast?
Adopting this mobile system?
Yes.
You know, according to literature on PHR or mobile health, there are many instances of resistant to using this mobile system, especially PHR. Acceptance has been one of the big problem, but there's no such problem in Mongolia because most Mongolia people have been carrying their own paper-based medical record notebook themselves because there's no other medical record at the hospital, so they had to carry their own paper-based medical record notebook. So they are used to carry their own medical record. So we are just replacing paper with a smartphone. So patient acceptance or patient consent has not been a major problem in Mongolia. So we have a very good unique situation.
Thank you, Professor Che. The next question is from Dr. Yudha. He's asking, is the data stored in cloud or in local server?
There's no local server. We have a central server. It's cloud-based.
Yes, he has a follow-up question.
Since Mongolia is a country, so it's very difficult to have a local server. Yeah. Yes.
He's asking, how secure is the security system to secure patient data?
And all national, this central server is heavily secured by and is stored at national data center. So they have a very secure, centralized national secure system. And we use several different softwares, also firewalls and several things for securing this data. And we also, Mongolia has very stringent security policy. It's even more secure than Korean security policy. So we are using several different measures, security measures.
Yes, thank you. We have our last question. How much is one portable ultrasound? Is it disseminated by the Ministry of Health?
Could you just repeat your question again? Sorry.
Yes. How much is one portable ultrasound? It can be used to help detect breech presentation. And is it disseminated by the MOH?
Yes, disseminate. At the moment, WHO and COFI has been providing all the funds for mobile health system and all the devices, including automobiles also. But I believe that Minister of Health of Mongolia will set up some budget for disseminating. Recently, they received a big loan from World Bank and Chinese government for developing as well as disseminating information system. So I think that the Minister of Health has enough fund to disseminate this mobile health system.
Sorry, we have one more question, Professor Che. It's from Dr. Sanjay. He's asking, how do you enter the data? Do you enter it manually? And do you do consultations in real time?
Currently, the general practitioner at the visiting health service team will enter data, and of course the images from mobile devices will automatically enter to the Galaxy tab. And also, a general practitioner, doctor, will enter his or her some assessment, and also he'll enter the CCD, continuity of care document himself for referral.
All right. Thank you for that wonderful discussion, Professor Che. And thank you to all our participants who joined us.
Yeah, it was my pleasure. And if there's any question, and please email me, then I'll try to answer all questions and also send some additional references. And thank you very much.
Thank you, Professor Che. Good night.
Thank you. Bye.